May is Mental Health Month, and it comes at a time when mental health concerns are heightened with the stress associated with the global COVID-19 pandemic and its effects on our lives. Lockdowns in recent weeks have shaped the economic fortunes with immediate impact on livelihoods and plans for the future, particularly for the youth. But the impact is not only economic, but mental. And we are just beginning to learn more about the effects of COVID-19 on mental health. What is concerning is that the existing medical structures to support people with mental health stressors are weak, and there is room for early and substantial support. Moreover, in some communities, cultural attitudes have caused some people to avoid much-needed treatment and counseling. COVID-19 provides an opportunity for a serious discussion about how to support mental health in countries across the globe, as well as across the continent of Africa, and make sure that this support can be widely accessible and acceptable. Welcome to Leaders of Africa Live. This is not just another themed webinar on COVID-19 where we talk at you, but rather this is a conversation that we're going to have together. And so we invite you to join in the conversation today. As you know, and if you've tuned in before, you know that you can engage in a variety of different ways. You can voice your voice in the chat, in the YouTube chat, which is right over here, or right over there. You will also be able to zoom in and call into today's broadcast. If you join at leadersofafrica.org/live, you can notice that there is a button to call in via Zoom. It is right down below. If you click that, you will be put in a Zoom waiting room, after which a producer will screen your call, and then it will be put live on air for you to share your thoughts and your questions for today's panelists. And lastly, you can tweet using the hashtag #LeadersAfricaLive. Let us know where you're joining us from. Select comments and calls, as I've mentioned, will be shared and discussed in today's broadcast. And that's it. We are live today, so it is very good to be with you. Before I introduce our panelists for today and we get into our discussion, I want to share a little bit of background on the issue of mental health, again, before we get into our conversation. According to the 2016 benchmark, the World Health Organization reports that there were 7.5 suicides per 100,000 in sub-Saharan Africa. Ghana is slightly lower at 5.2. Kenya is at about 3.2, although this is much lower than places like the United States at about 15.3. There is still a troubling trend in many countries around the world, despite it being lower than other countries across the globe. When it comes to spending on mental health, low and middle income countries spend under $2 per person on mental health care, which is about just 0.5% of the total health budget that is devoted to mental health, particularly amongst low-income countries. This is obviously higher for high-income countries, but officials say even that 5.1% of high-income countries is still low. This is obviously a very basic measure of mental health gaps, more of which we're going to discuss in today's broadcast, which brings us to our guest today. And we are joined by Ms. Nandy Ntiamoah Walker, who is an expert in mental health and a clinical psychologist. Nandy is the managing director of the Corporate Wellness Consultancy and joins us from Accra, Ghana. Welcome, Nandy. How are you?
Fine, thank you. Thank you for having me here, Peter.
It's great to have you. And we are also joined by a special guest, Dr. Frederick Wekesah. Frederick is an epidemiologist and scientist at the African Population and Health Research Center, a premier research think tank. Frederick comes to us today from Nairobi, Kenya. Welcome to you, Frederick.
Thank you so much, Peter, and thank you for having me. I'm glad to be here and to discuss one of the most important topics and one that I'm very passionate about.
Wonderful. We're so happy to have you both here today. And obviously, as you can see, we're joining from all different parts of the globe today, which is wonderful to have this really important conversation. And as we get into the conversation, I want to start with you, Nandy, about about what is mental health. Obviously, we talked about mental health in the intro. When we were mentioning this event, we were saying this is about mental health. What is mental health exactly? How can we define it? And what are the boundaries of what we would term as mental health?
Okay, so I would define mental health looks at an individual's cognitive, emotional, and behavioral well-being, and how the way you think, the way you feel, the way you behave affects your day-to-day functioning. Day-to-day functioning looks at your relationship with friends, loved ones, work colleagues, as well as how it also impacts on your daily functioning. So that is what mental health is. Mental illness looks at a disorder or an illness that impacts on an individual's cognitive, emotional, and behavioral well-being negatively, and also has a negative impact on the individual's day-to-day functioning. So it negatively affects the individual's relationship with friends, loved ones, colleagues at work, and it even goes a long way to affect maybe the individual's functioning at the workplace and outside, anywhere you find yourself. Yes.
Now, Frederick, from a scientific perspective, how does mental health care compare to other sort of non-communicable diseases? And I know that you focus on non-communicable diseases more broadly. How does mental health really fit into that zone of non-communicable diseases?
Sorry, Peter, I don't know if that question was for me. I lost you at some point. Do you mind taking that again, Peter?
Yes, sure. It's perfectly fine. So, as I mentioned, mental health, Nandy has mentioned what mental health is. How does it compare to other non-communicable diseases? And I know that you focus on non-communicable diseases more broadly. So where does mental health fit in with some of those scientifically?
So, Peter, it will surprise you to know that for a longer time, as epidemiologists and public health practitioners, it was difficult really to get mental health to be classified as a non-communicable disease. Non-communicable in the sense that it's not transmitted from one person to the other, as is the case with communicable diseases and infectious diseases. Certainly, the best example that we are grappling with right now is COVID-19 and how infectious and virulent that is. So it fits into the non-communicable diseases in two ways. First of all, because it's in Africa, it's only an emerging concern, as has been with most of the non-communicable diseases, in which category we have cancers, we have cardiovascular diseases, we have other conditions like the chronic obstructive pulmonary disorders, which really are only coming on the heel of infectious diseases that have for a long time been battled by African nations. So that's the first way that we have, mental health fitting as non-communicable disease. But secondly, as is the classical definition, it's not transmittable, and it has a common, in a broader way, common risk factors as they are classified with the other conditions that I've just mentioned.
Wonderful. So Nandy, building on now that we have sort of a sense of what mental health is, I'm curious, what are some of the stressors that people are facing in the context of the COVID-19 lockdown? If you don't mind speaking about how those stressors look in particular in Ghana, and I know you're familiar with working with people in Ghana in particular. So what are some of those stressors that people are facing?
Okay, so here in Ghana, we realized that before, let's say, COVID-19 or before the lockdown, you find out that people are already going through their own stresses. So you have issues of unemployment, you have issues of financial crisis. Young adults who just finished the university are looking for job opportunities. In Ghana here, for example, we have majority of Ghanaians within the informal sector. You have people who are into trading, you have drivers, you have cleaners who get day to day, they get money to go to get basic needs through these small scale business trading. And then we also have situations where people are already diagnosed with mental health issues and the issues are being managed gradually. So these are some of the stresses that are already happening before the lockdown. So currently, the lockdown and then the COVID-19 pandemic has increased or has led to issues of unemployment. Now jobs are on hold. People are having a financial crisis. Already people, for example, at Corporate Wellness Consultancy, we see cases of people who were being managed on mental health issues. And currently, based on this lockdown, you have cases where they relapsed out of miscommunication or fear that one way or the other, they've been infected. They've done all the tests in the public hospitals. It came out negative. They're not showing symptoms, but they still believe that they have COVID-19. People are living in fear as a result of this sudden change, this novel virus, which currently is leading to all kinds of stresses like adjustment issues, depression, anxiety, and panic.
And how about you, Frederick? What are you seeing in your environment in Kenya and in East Africa more broadly? Is it a lot of the similar things we're seeing in Ghana and in other West African countries? What are you observing on the ground?
Yeah, Peter, we are seeing really the same things, and I'll just continue from where Nandy has left. These are very interesting times. COVID-19 did not come with a script on how we could deal with it. So there is a lot of mental health problems that people are forced to deal with. First, really, it's because of the restricted movements and interactions with, social interactions with people. So the requirement to stay indoors and stay with some family members day in, day out, without knowing when this thing will be over, really is perhaps one of the biggest concern and issue that is affecting people in Kenya, in Africa, and I dare say the world. I don't think it's any different from the world, because we are seeing the same measures in combating COVID-19 being implemented across the world. So really the requirement to stay indoors limits interactions, and that comes with mental health challenges. By so doing, when people are really limited in one area, there's overdependence on what is within the environment. Perhaps there's what we can look at exposure to social media, problematic internet use, which has been linked to mental health conditions. There's increased alcohol and substance use, because people really want to deal with the emotions, as Nandy mentioned earlier. Mental disorders are linked to the emotions, to the behavior of people. So issues around increased alcohol and substance use are really additional stressors that we are seeing. But really anxiety, to me, I think if you were to ask me to rank what is the biggest stressors that we are seeing right now, is the anxiety of not knowing when this will end. And this comes in many ways. Governments are learning on how to deal with this as every day comes with new challenges. But people who are dependent on government for direction are becoming disillusioned. So anxiety and anxiety attacks and what comes with it, really, if you ask me, are really some of the key stressors for mental health and mental health problems and mental disorders that we are currently seeing, not just in Kenya, but across Africa. And Nandy, yeah.
Yeah, Nandy.
Yes. And I wanted to say also that in my culture here in Ghana, for example, social support is very key here. And we tend to, spirituality and religion is very key. We tend to derive strength from each other. So in as much as COVID-19 is very infectious, and we are supposed to practice the health protocols, we realize that practicing social distancing and physical distancing is a challenge, and people are not able to reach out to others. You realize that based on this novel condition too, a lot of people are stigmatizing the infected and then the families of the infected. So you realize that suddenly our way of life and how things have changed a bit, which is also creating some form of adjustment issues, adjusting to this sudden change.
And how about the varied impact across different age groups? Obviously, many countries are on the younger end of the spectrum in terms of having a big youth population. But are you seeing the effects of COVID-19 in terms of mental stressors having different or similar effect across different age groups, or is it influencing different age groups in different ways? What does that look like, Frederick?
You could say that, and I think we'll need a bit more analysis into this matter. But anecdotally, you could look at different age groups come with different responsibilities. Certainly for the younger people, and I think you asked how the differential effect on the younger people. It's difficult to contain the younger people. They're always on the move. So you can imagine when the requirement is to social distance, to stay at home and practice, public health protocols of staying away from other people. How that can have a bigger impact on the younger people. And I'll link back to what I said earlier. So younger people are the biggest consumers of internet and online information. And if you want to look at what they would resort to doing during this period of containment, it would be perhaps increased and problematic use of the internet. It could be the alcohol and substance use. It could be engaging in violence, whether it's cyber, online type of violence, or just physical violence. And certainly even here in Kenya, we're seeing cases that are being reported among younger people with regard to gender-based and intimate partner violence. And you could see that the numbers, at least the ones we've had, are really among younger people than among older people. So you could argue that this is affecting different age groups differently. And perhaps the biggest demographic that will be suffering this lockdown and this impact of COVID-19 would be the younger people. But let's not forget that we have older people, family heads of households, you have mothers taking care of the children, and COVID-19 does not spare, their responsibilities. And they are supposed, for example, in Kenya, you have, like Nandy said, you have people who are supposed to step out of their households and seek for food for their children. And how does this work on their psyche or on their responsibilities if they cannot be able to do that? So you're right, it affects different people differently, and there'll be a need for a deeper analysis and targeted interventions on how different demographics can be helped to emerge from this COVID-19 situation.
Wonderful. Nandy, you mentioned religious groupings and the importance of religious groupings in just sort of getting the kind of social support people need and also spiritual support. How are religious groups dealing with the COVID-19 outbreak in terms of providing that support today? As you know, a lot of religious organizations are going online, are doing webinars, are doing using Zoom, using Facebook Live to reach out, and people are tuning in very large numbers, despite connection challenges that we could imagine. But what does that support look like? And is it working? Is it there? And how can it be complemented by some of the work that those in the mental health field are already doing or are trying to do?
So currently, we are also doing the same thing. Now, church has moved into, we do church services on Facebook, you have church service on Zoom. And then we sometimes have situations where you have church leaders and members call in on phone to pray or share a word or encouragement with you. We also have WhatsApp groups where words of encouragement are shared with members of the church by the senior pastors as well. In some situations where we have majority of people too uneducated, some people also do some of the church leaders also visit the houses, one person, one leader per house, practicing, adhering to all the protocols and providing some form of a positive word to them to allay their fears and all that. And that is also assisting with our work as mental health experts, where we believe that social support serves as a form of intervention to help people who are going through difficult challenges or experiencing mild forms of symptoms like anxiety and depression and grief. You've lost a loved one through to COVID. You cannot see the person because the body becomes government. So the religious bodies too are doing very, very good work to help the public as well here in Ghana.
And Frederick, in terms of getting out the message about the importance of mental health during COVID-19, what are some of the actors that are doing some of that work? I can imagine that some religious organizations are providing that suggestion of receiving support and pointing their members in that direction. But what are the sort of the agents on the ground who are enlightening people about the opportunities for getting some form of mental health support? What do you see in Kenya and just broadly in your research?
Peter, the church may have taken a bit of time to get onto, you know, to get on with the system, in the sense that perhaps some of the people who were reluctant to close their doors when the requirement for staying at home and avoiding crowding was necessitated really was the church. But in the same breath, we've seen that the church, after agreeing to participate in the public health protocol, have really been at the forefront in not just passing on the messages to their crowds during their online services, but also providing their grounds for testing as and when mass testing, for example, that is happening in some parts of Kenya, is required, that the church has been ready to provide their grounds for such kind of testing. But more importantly, when it comes to the welfare of the people, the church has been there to gather foodstuff, to gather social needs that the people may require, and take it to their members and even beyond within the communities that they work in. But beyond the church, we have many other actors. As you can imagine, these are multi-sectoral, requires a multi-sectoral approach. And we've had different community-based organizations. We have international and national NGOs within Kenya and within East Africa. You've had even individuals, the so-called influencers, also on social media and within their own spaces, being used. At least in Kenya, we have seen video and infographic messaging coming through our social, our influencers. So there are many ways that have been used. Television, you've had political leaders, and you've had international figures also that have been brought into to be able to package this message in a language that the people can easily understand. So it's taking a multi-sectoral approach, which is quite efficient because different people appeal to the different sections of the population differently. And at least when it comes to asking people to stay at home, not to worry about tomorrow, and just taking this in their stride, we can say that it has worked, and hopefully it continues like that until we beat this COVID-19 situation.
And Nandy, what are some of the outreach? Go on. What are some of the outreach efforts look like in Ghana?
Okay, so here in Ghana, for example, our president and the government of Ghana have set up a national COVID-19 emergency team. The mindset was that maybe it would just be made up of doctors and nurses, but the government has also taken steps to do proper risk assessment and realize that there is need to add mental health experts into the national team. So when you have the Minister of Information discussing issues on the cases going and increasing, you have mental health experts, psychologists, psychiatrists also talking to the general public about the need to show love, compassion, kindness, and not kick out stigma. We also have here in Ghana a number of mental health bodies like the Ghana Psychological Association, for example, which governs the works that we do as mental health experts, as well as the Ghana Mental Health Authority. They also have brought out psychosocial support hotlines, emergency hotlines for people to call in times of any form of stress, any form of anxiety. We have over 30 mental health experts available to talk to people in times of stress. We have hospitals like Kolebu Teaching Hospital also setting up a COVID hotline to address mental health issues with the public. We also have NGOs such as Friends of Mental Health, and MESOC, Psych Edu Africa. A wide range of NGOs are also doing a lot of outreach, creating more awareness during these times and providing support to people during this challenging time here in Ghana.
And Frederick, just building on what Nandy said, and talking about a variety of different actors who are involved, hospitals, more formal medical establishments, down to non-governmental organizations as well. What is the composition of those who are engaging in mental health support in Kenya, but also across the continent on the basis of your research? Are there weaknesses in terms of the more formal ways in which mental health practitioners are dealing with mental health concerns? That is, the hospitals, for example. Are there strengths that can be leveraged in NGOs? What does that panoply of different actors look like, and what are some of their strengths and weaknesses in dealing with public health concerns?
Peter, we could classify mental health support in two. Certainly when it comes to social support at the family level, you would imagine that people fall back to their family members, to their friends. Certainly that has been curtailed in this time of COVID-19, right? We have people asked to stay at home, perhaps not reach out, at least physically, but perhaps call up friends that they want to talk to, and just discuss about what they're going through and share notes and experiences about how they can go about this. But in the formal sector, I would imagine that we haven't seen a lot of differences in those really who are previously providing the support to those who are providing it now. It's not that the group has changed. In Kenya, certainly we have the Kenya Psychiatric Association that, together with other stakeholders in the mental health sphere, carry out, provide online resources, carry out conversations online. We have a regular weekly conversation led by the Kenya Psychiatric Association that is called Mental Health 254. I guess the challenge is the reach. So who are reached by this support, whether it's online, because people cannot walk into health facilities to get care. So because of the restricted movements, at least in urban areas. And in rural areas and other informal settlements, these services are not necessarily readily available. So what is happening is that in urban areas, you have this plethora of platforms where people can seek care. They can go online and follow these conversations by experts, ask questions and get them answered. There are those who have access to their doctors and can call them and perhaps get the help, consult on the questions they have. But we have a bigger proportion, Peter, of people who are not being reached by this. Church certainly would have been a place where people get religious and spiritual solace, and sometimes helps with their emotional issues. But that has also been constrained. So what is happening really is that you have a smaller group, the same traditional players, doing what they can do, yet the resources that they could have used have been pushed to what is supposed to be the most emergency situation right now, dealing with COVID-19. So even when they would, you can imagine that their reach and the effectiveness of what they're doing is really at best rudimentary, but it's better than having none. We have call-in phone lines that are provided. Certainly there are organizations, including mine, that have given employees access to psychosocial support as and when they need that. But these are very small section of the population, Peter. And I would say that a lot is still required. And perhaps post-COVID, there'll be a lot that will need to be put in place to be able to help people who emerge from this, say with post-traumatic stress disorder and other anxiety issues for having pulled through the COVID-19 lockdowns and whatever comes with that.
Yeah, absolutely. And I want to build on some of these points and also get to a comment from the audience. And I want to remind the audience that you should feel free to comment in the chat at leadersofafrica.org/live, or also call in. Please feel free to call in. You'll jump into a Zoom room and then you will be able to have your comments and thoughts heard live. And this one comes from Michelle. She says, and I'm going to read this out, mental health stressors come from anxieties of a fear of falling sick, an anxiety of what the future holds, an anxiety of not knowing how to deal with the needs of the present. I want to talk about that second one that Michelle brings up, the anxiety of what the future holds. And that was something, Frederick, I think you mentioned a little bit about people's anxieties. And what does it take in terms of dealing with that one, a fear of the future and what happens? You know, how does one sort of deal with those anxieties? Is that a way in which they could seek support amongst others or amongst professionals? Or is that something that also has to be complemented with some direction from political leaders or those who are managing the crisis itself? How do you balance that out? I'm curious your thought, Frederick.
Yeah, that is a big question, isn't it, Peter? That you have people locked within the confines of their households, and they are facing these anxiety attacks, and they really do not know where they can get help because information is not outright there. And there are negative coping mechanisms that people are using. Certainly, that's not what you wanted to hear, Peter. But people, because of loss of livelihoods, not knowing when this will be over, are resorting to maybe problematic use of internet. I think I mentioned this earlier. Substance and alcohol abuse, and just being angry and overly aggressive and things like that. But those who know and those who can access help have tuned into the platforms that I mentioned earlier, perhaps within their social capital, talk to people that they consider friends, family, their doctors if they could, reach out to their religious leaders, and just discuss this. Certainly there is free information out there. I mentioned earlier that we have the Ministry of Health with guidelines that have been set out, available online. They're telling people to try and not worry about what will happen. That, not engage in, try to find a routine that will fit their schedule. And if they can work from home and not venture out, they should do that and reach out to their family members and try not to certainly worry, which is easier said than done, Peter. So if you were to ask me, the opportunities for support are there for those who know, which is a very small section of the population, certainly perhaps in Kenya, in most of the African countries. I don't know what's happening in Ghana, Nandy.
Yeah, Ghana, you want to share, Nandy, your perspective on that?
Okay. So in Ghana, for example, most often than not, when people face any form of anxiety or stress, the first point of call is the church. So one of the things that we have both is the church. So you find out that a lot of the church are very much interested in mental health related issues like ICGC, Action Chapel, and then the Catholic churches, among others. So when people reach out to them with such fears and anxieties, these pastors and leaders or spiritualists, because they are very much aware of mental health issues, we've educated them on them. They also take a step further to also refer such individuals who are showing serious anxiety or panic issues to mental health experts to provide services for them. We advise leaders to do that because in our part of the world, mental illness is seen as spiritual, and sometimes the treatment that is provided for such people can be very inhumane and can be very bad. You have people being chained and families being isolated and kept in certain places and conditions that do not help. So as in Ghana, for example, you have the public sectors and then the private sectors and NGOs doing a lot of outreach programs to advise churches, family members as well, to refer cases to experts who can provide good services and also protect the rights of these people going through these kinds of anxiety. We've had a number of cases here in Ghana and at my practice, Corporate Wellness Consultancy, where we see cases referred to us by families and churches. So we realize that we know currently gradually people are getting to know where to seek help from and not just rely on the old traditional practices, which was not helpful. So, and it is exactly what is happening during this COVID pandemic period. People are referring cases to mental health experts, both private and public, to provide services for people going through anxiety and fear of the unknown of the future.
Absolutely, and I want to build on a couple of thoughts. I have a question here from Ntiamoah E, and she writes, good point on these support strategies put in place. In terms of youth and support, I was wondering whether they have mental health literacy or motivation to seek help, and what should be done if they are lacking either the literacy or the motivation. Frederick, what do you think of Ntiamoah's question here? Do you think they lack some form of literacy, or is it motivation, or is it a combination of both, and what can be done?
Yeah, Peter, even before COVID-19 knocked on our doors, mental health literacy at the population level, certainly in Kenya, is quite low. And I would imagine that in other parts of Africa and perhaps parts of the world as well. Mental health and mental disorders are shrouded in a lot of secrecy, in a lot of stigma, and so there's a lot socio-cultural factors that drive hush on mental health conversations. Certainly, when it comes to mental illnesses and mental disorders, we have people who have mental disorders being stigmatized, being hidden at home. And there are many stories like this that you hear about people not wanting to be diagnosed with mental disorders, because when that happens, then the society reacts in a totally negative way. So there is stigmatization, there is that taboo and hush conversation around that. So literacy is really a big problem, and that's really a gap that needs to be filled, Peter, certainly in Kenya and perhaps in East Africa and other African countries. That said, there's a lot of work that has been happening. We've seen over the recent years a lot of conversation about mental health, about suicides, about self-harm, about substance and alcohol use, problematic substance abuse and things like that. So it's a debate that is shaping up, and a lot more people now are aware that mental disorders are illnesses like any other that require help, and they know that they can seek help. But the challenge comes in when they need to seek help, Peter, because of the primary care in most countries in Africa and in Kenya, you have very few practitioners that can offer mental health. If someone was to go to a primary healthcare setting, they would have to get referred to a bigger facility, a specialized facility that may be a little bit further from them. Now, this delays the point where they can seek care. And this is really even before COVID. Now, with COVID and all the challenges and the anxiety that come with it, you can imagine that the number of people needing this help has doubled, maybe grown tenfold, or many over times over. And we have people who need help and they cannot easily get access to it. First of all, because they don't know that they need help. But secondly, because if they were to be diagnosed with problems around mental health and mental disorders, the society would stigmatize them, would perhaps disenfranchise them and such kind of issues. So we need to do a lot of work around mental health literacy, and really it's an area that I would suggest, if we come to that governments really invest a lot using different approaches to educate the public about.
Yeah, and Nandy, I'm curious, building on something that you said as well, and in this similar vein, we had a comment from Carolyn, who says, I agree that there is a very small proportion of people getting support. There is still a lot of stigma associated with people seeking help. I wonder if you can kind of explain what that stigma is and how it manifests itself, right? And how does it actually get translated to others? How does it influence people's mindsets, influence the decision-making process of somebody who may otherwise seek help?
So our culture, for example, sees there's a lot of stigma attached to mental illness based on how we see mental illness itself. Because if you show signs of mental illness, it means you are weak. In our culture, for example, when a man loses a loved one, you're not supposed to show emotions or even cry. When you show emotions, or you even say you're depressed or anxious because you've lost a loved one, you are seen as weak. And people have negative connotations to mental illness itself. When you're mentally ill, in our part of the world, you are seen as demon possessed or a witch or a wizard. So there's a lot of stigma, and even people find it very, people are so afraid to actually seek help for fear of the fact that if they see Matthew going to, let's say, 37 Military Hospital, Kolebu, or even any healthcare facility to seek mental health attention, or even the psychiatric hospitals, Pantine, to seek mental health treatment, it means you have a problem. Even in our culture, for example, if a man is going to marry, the family of the man, a woman in another culture here in Ghana, in another family here in Ghana, the man, one of the criteria is to look out for, which is a no, you don't go into that family, is if you find the man finds out, or the family of the man finds out that the woman's family has cases of mental illness. So there's a lot of stigma attached to mental illness here in Ghana, and it really also affects people seeking help. Others too don't know where to go, because for them the last resort is a spiritualist, a traditionalist, or a herbalist for treatment. And a lot of people too do not know how to read, do not know how to write. So it also becomes another challenge for them getting the help that is needed. But I would also want to add that here, for example, during this COVID time, for instance, there's been a lot of mental health awareness in different languages. Here in Ghana, we speak Twi, Ga, Hausa, where we have radio stations that are now doing mental health awareness through these different dialects to create awareness for people to seek help at the right place and then get the best care that is needed. So stigma is a big issue. There's still room for improvement.
Yeah, go ahead, Frederick.
Peter, to me, I think the stigma and the cultural practices that stigmatize people are on one side. I think to me the other bigger problem is the ignorance around how serious some of these discrete conditions can be. The dismissal that depression and anxiety are nothing to worry about really makes people delay in seeking care when they should have sought and get help when they needed to get help. So to me, one of the emerging challenges with mental illnesses are because they are discrete conditions and people are depressed and anxious, and they are not ready to share with their family members because it can easily be dismissed to be nothing. Because anyway, everyone is going through the same challenges like they are going through. Who are they to be more depressed than the other people, the other person next to them?
Exactly.
And that has driven a lot of people from hiding some of these conditions and only seek help when it's too late. And you can imagine what that means. So it's too late for rehabilitation. Some people fall into depression and take their own life through suicides and things like that. So to me, that's really one of the bigger challenges, apart from the stigma and the cultural practices that are really rife in the community, as Nandy put it.
And then and just to support what he said, it's also one of the biggest issue, because if you are going through a stressor and another person is unable to cope with the stressor, and you tell the person that this is what I'm going through, and the person is like, but I'm also going through the same thing. Why is it that you are sinking or falling? Sometimes they mock at you, they laugh at you. Even I've seen cases where the patient was beaten by the parents because you cannot say you are depressed, you cannot say you are suicidal. You slapped left and right. So you sink in your pain, sink in your worry, sink in your fear, sink in your stress. Be strong, be bold. It's something that is going on, and that is also one of the reasons why people find it very difficult to seek the help that they need, because they are also going to be stigmatized or insulted or suspected in one way or the other, because they are showing weakness or lack of strength in a certain situation that they have been able to overcome, and you can't overcome it.
And I've got a question for Frederick. We'll start with you on this question, and I think it's an important question. It's something we've kind of been talking about in general terms, because obviously up until this point we've been talking very qualitatively about what we're seeing, and trying to interpret based on anecdotal information, qualitative information, what we're seeing on the ground. But we have this question from Juan Pablo, who says, are you collecting data about the psychological impact of COVID-19 in your countries? An emphasis on data here. And I'm asking Frederick, like, before COVID-19, what was data collection related to mental health looking like? And have we seen any improvements, any focus on the importance of data during this COVID-19 era, and perhaps thinking about it after the COVID-19 era, if God willing it passes? So what does that data, what does that element look like?
A very important question, Peter. I mean, issues around mental health, not just the healthcare aspect of it, but data and quantifying mental health as a problem have been on the back burner for a long time. I work for an institution that really is premier in terms of generation of evidence and using that for policy and programming in Africa. And it's an area that we've taken a lot of keen interest in. You ask what we're doing in terms of data, and even before COVID-19, I'll talk about what we've done up to this moment and perhaps what we're planning to do. Certainly, we are planning to do something with respect to COVID-19. Until this point, we've had no data on the burden of mental illnesses, mental disorders in the different demographics of the population, whether it's among younger people or older people. What we have are subpopulation level studies that really are not very useful, also, or hospital level studies. So what we are beginning to do at the African Population and Health Research Center is to collect data on child and adolescent mental disorders. We are looking at 5 key conditions. We're looking at attention deficit disorder and conduct disorder. Key conditions to be able to quantify the problem and look at what are the risk factors driving these conditions and what are the protective factors that can be able to prevent young people from sinking into getting this problem. And by so doing, really use that data to advise policy and programs in Kenya. With regard to COVID-19, let me step back a bit. So once that is done, we should be able to extrapolate that work and do another study among the older population, because we know that mental health disorders begin when people are young and really pull through as they get into adulthood, as Nandy would agree. What we are doing with regard to it, we have shorter term and longer term plans. Shorter time is looking at how this is disrupting people's lives and reaching out to people, certainly through phone calls and phone interviews, and really just try to understand how this problem of COVID-19 is affecting their daily lives. Anecdotally, we have an idea of how people are being affected. We have discussed this already, but we want to quantify that and be able to put numbers to it, because what you cannot measure, you cannot improve. So we believe we are putting together a study to look at what people are going through now and what can be done now. But in the long run, we know that there are conditions that will persist, will have that impact of this COVID-19 on people beyond this period. And we, together with other people, are setting up studies that will collect data on impact of COVID-19 on children or every member of the population, and what can be done to bring people back to normalcy, at least when it comes to mental health, physical health, and other aspects of their health. So there is a gap, yes, but we have understood opportunity now that we can take up, and like many other people in research are really willing to not let this opportunity pass. So that's in short what we are doing, certainly in Kenya and with partners across Africa.
And I should just underscore, Frederick, what you mentioned, the great initiatives that the African Population and Health Research Center has been doing in this area in particular, because as you mentioned, there had been very little data to really measure success of any initiatives, because obviously one of the things you need to make sure you're doing the right thing, forming good policy, forming good support, is some way of benchmarking yourself and knowing how well you're doing and know the areas of strength and weakness, right? And so obviously the African Population and Health Research Center has been really at the fore of this movement towards thinking about things more purposely and data-centric, evidence-driven. Nandy, to you, on this issue of data, I'm curious what kind of benchmarks that you use to kind of measure the effectiveness of your own practice, for example, of ensuring that those who come to you are treated effectively, and also your own benchmarks for how you sort of interpret and engage how well mental health support is going in the country. What are some of your both formal or informal benchmarks that you use?
So at Corporate Wellness Consultancy, we have demographic data that we take from our clients. And so we put it on an Excel sheet, and with time we do analysis to see what are the common disorders that are being presented at our facility. Is it schizophrenia, depression, or anxiety? And then we look at we collect other data from the client or the caregiver, where we look at, we evaluate the specialists who render services to these clients, and then the caretakers. We ask them questions about the services rendered, right from history taking to psychological assessments, right down to the interventions. And then after that, we actually sit with the specialists, and then we do analysis, and then sit with the specialist, discuss. These are what the experts are saying. We don't mention names. We just do it overall at the end of the year, and then we discuss it and see how best we can restructure and then change the structures. So, for example, we know that in certain situations where we realize that after you have assessed the person and you see severe forms of psychological issues or challenges, we also look at referring cases to the psychiatrist or senior specialist to also do their own analysis, do their own studies, and then also provide the necessary interventions. So we work with psychiatrists. We also see cases where we require also the assistance of medical doctors. So based on our data, we also discuss with them that is the issues we are facing, and then they also come in to render services to us to provide the best of care and services to these patients. We also are currently looking at even doing researches in the area of mental health, looking at the psychological impact of this COVID pandemic, as well as the psychosocial or the coping strategies Ghanaians are using to deal with these challenges and fears of the unknown. So these are some of the things that we are doing privately, and then other public sectors are also doing a number of researches and bringing out papers which are being shared in radios and then TV stations to discuss, the impact of mental health on people's way of life, as well as this current pandemic.
And Nandy, just coming back to you, just building on some of the things that we've been talking about this conversation, I have a chat message from Suleiman, and I think it's a good sort of practical question before we dig into deeper in our last few minutes in some of the technical areas. But Suleiman says, during the time of COVID-19, how can you tell, or rather tell that an individual needs mental health counseling? In other words, how can one sort of self-assess or help assess very purposefully and more scientifically their own needs, their own mental health needs?
So how can you assess it? We all go through mental health challenges. We all go through sadness, anxiety, stress. But the majority of people, when you look at a bell curve, majority of people have strategies to cope or deal with stressors. However, in a situation where you realize that you need help is where you realize that you don't have enough resources to deal with the stressors, or you're overwhelmed with a stressor that it has suddenly changed your way of life or your behavior, and everybody is complaining that this is not how you were at first. What has changed? These are some of the warning signs that makes you realize that somebody needs more attention. You realize that the person who was very open, very playful, suddenly the personality of the individual has changed. This person is more withdrawn, easily agitated, showing all signs of anger issues. This person is showing too much or excessive fear, believing that something doom is going to happen, all these, and it's affecting his or her behavior, and then it also affects the relationship with others around that individual. and also performance, for example, at work, your relationship with friends, loved one has changed negatively, these are signs that such individuals need to seek help.
Mm-hmm. Frederick, are there others you mentioned? Yeah, go on.
And also,
I think for now it's even more worse because there is this thing about people being required to stay away from other people. So you can imagine the complexity that brings into being able to identify a problem when there is one really. So the requirement that social interaction, at least with other people, is curtailed, and people may fall into may fall into areas where they cannot meet other people, and that becomes a chronic situation that they cannot easily lift themselves out of, right? So you have people who, even a small thing like news is very depressing nowadays. I'm going to avoid watching news. And then they take that as a way of life, and it really eats into their psyche and becomes a very problematic issue. So this, in addition to what Nandy has raised, really the issue of loneliness that is brought about by this current situation can aggravate even situations that were much more improved, were it not for the COVID-19. So in terms of COVID-19, in addition, excessive consumption of internet, for example, you may think that it's just another way of coping, but that can be really a stressor to falling into an emotionally unhealthy place, right? So there are things that really are context specific in terms of this day that can be missed out if we're not careful and looking out on the nitty gritty or the smaller issues that may pass unnoticed to people who are not keen on looking at this. Yeah.
Good point. I think that's an important thing to kind of assess some of these signs of mental health stressors in the context of dealing with others. It's sometimes hard to do that when you are isolated to some degree, and I think that's a really important point. We're obviously coming up against time. We got about 5 minutes left, so if anyone would like to call in or get your comments in, please do so now, because we will be finishing up very shortly. But I want to turn a little bit to sort of policy a bit more, and sort of the more public response to public health concerns. And I want to start with you, Frederick, with a comparative question. I'm curious, we've been talking about predominantly Ghana and Kenya, because obviously that's where you're joining us from. But I'm curious, Frederick, broadly speaking, across the African continent, what are some of the countries that may be doing a little bit better job in dealing with mental health concerns than others? And can we learn from any of the best practices that are present? Or are many of countries kind of performing in very similar ways? So is there big variation, or is there not is there not that big of a variation? And if there is variation, can we learn something from maybe good practices that are occurring in some corners?
Peter, at the national and policy level, I think most of the African countries really compare. There's a lot of neglect and chronic underinvestment in mental health and mental health programs and in the infrastructure, like the mental health care system, for programs that are devoted for mental health. But at the local level and sometimes the organization level, there are many players in different countries that you can quote. Certainly, big examples stand out, like the Friendship Bench in Zimbabwe, where you have an intervention, a very simple intervention from using community resources that have been set up to help people at the community level, women and adults, men and children, to be able to address some of the mental health conditions. In Kenya, at the national level, we, in 2015, I think, passed the mental health bill, and that was supposed to midwife a process that would streamline programs and policies and guidelines for mental health. Certainly, there's a bit of struggle for that, but we have seen progress in the right direction. It's not how things used to be a few years back. In Kenya, with respect to COVID-19, certainly I've seen guidelines to healthcare workers on how they can help people who are quarantined, people who are isolated, their family members, the healthcare workers themselves. But I've also seen messages to the public on how they can, keep themselves safe and healthy and emotionally healthy during these very trying times. We have seen the same happening in other African countries, really. So on this, I wouldn't be very harsh on African countries. There is still a historical explanation to this. The underinvestment, not just on mental health, on health specifically. Amount of budgetary allocation to mental health is usually less than 1%. You showed in your earlier statistic, less than 1%. So this is there. But I would want to look at the positives, really, in the sense that over the years, there's been a lot of conversation about this. There's been a lot of support. There have been a lot of other game changers and influencers that are not necessarily from government that are coming up to say, hey, this situation is with us. And from the community level, who can we mobilize? Who can we bring together? Can we talk to the community, even without waiting for governments to come and act? Can we already start putting things in place that can help ourselves so that we can overcome these things? So conversation around about suicide, conversation around, gender-based violence, anxiety, and issues like that are happening, albeit in very small population caucuses. But I can only see a brighter future in this. So things will get better, perhaps, with an opportunity like COVID-19, giving us another reason on why we should prioritize issues around mental health. So, I mean, that's really my briefing on that, in the sense that it hasn't been great at the national and policy level. I don't think I can pick one country over the other. Perhaps some of the bigger developed countries could be doing much better, but really comparable, and there's room for for improvement, and there are many things that we can do that need to be done. But there's an opportunity for us now to use this COVID-19 to be able to improve our healthcare systems to respond to the needs of the people.
Yeah, Nandy, how about that national policy level that Frederick has just mentioned? What does that national policy level response look like in Ghana? You've mentioned a little bit of what the government's been doing, but in general terms, like, how would you evaluate that national policy response?
Okay, so currently Ghana Parliament has passed the Mental Health Act 2012, and we just also passed the LI to start implementing the strategic plans to improve the mental health system here in Ghana. And not only improve the mental health system, but also, as Frederick said, to also look at health holistically, not just medical, but also look at health in the area of the mental health as well, because the mind and body interact and they play a very vital role, because whether you have any medical condition, in one way or the other triggers a mental health disorder. So currently the government have passed laws and policies in place, but there's still a lot of room for improvement, because we also still have similar issues where when the health budgets are passed, is provided annually by the government, you have less than 5% of that budget going into mental health systems. And mental health system looks at policies, plans, and then infrastructure to be able to contain these kinds of cases, because you have most of the psychiatric hospitals do not even have beds, or the deteriorating infrastructure to even provide the necessary services that is needed for people who need such help. So we have some policies in place, but there is still a whole lot of room for improvement to also improve the mental health system that Ghana has currently.
Wonderful. Yeah, go on, Frederick.
And that's really the role of this. Really requires a multi-player approach, really, and that's where we come in as researchers, as consultants working this space, like Nandy and her outfit. And there are many proposals that we working together with government. For example, in Kenya, we have a number of recommendations that we're making to government about mainstreaming mental health in all sectors and industries and policies that government comes up with. Because there's no health without mental health, Peter. You are familiar with this big mantra, and that's really what we're harping on. That if you want to address mental health, you don't need to do it in a silo. You have to ensure that it's addressed in all aspects, in all industries, in all policies, including sexual and reproductive health policies that you pass. we are looking at, recommending about budgetary allocation, not just to health, but to specifically for mental health, it should be around 5% and above. Training and employment of additional healthcare workers, especially at the primary care level. These are things that we know have not happened, but these are things that are on the table that governments are listening to. And a lot of, especially in a country like Kenya, where health is now devolved, you have 47 partners to work with, Peter, to actually realize this kind of ambition, where every facility closer to the people can have a healthcare practitioner at referral level, at the primary level. You can have non-specialist people trained at the community level to really offer support to people. So there's a lot of opportunity, Peter, and this really should be able to form a benchmark or at least a platform for us to improve on this. Yeah.
And to add to what Frederick is saying, even here in Ghana, for example, you have now currently all our public hospitals. It's mandatory that we have a psychiatrist and a psychologist, on board to run mental health clinic, even in our public hospitals. Now we have a lot of NGOs also going into doing a lot of community-based education awareness programs. You have NGOs and international organizations coming in to do more training to get more people into the field of mental health, because the professionals are limited here in rendering such services. So there's a long way we also have to go to also improve mental health in our country as well.
And last question to you, Nandy. Frederick gave a number of different sort of policy prescriptions, but also what I really liked is that it wasn't just all about what the government should be doing, but also a lot about what different actors can contribute and in a cooperative effort, right? And I think this seems like an important point of consensus. It's not just the role of the NGOs to pick up the slack, right? It's not just the role of the government, right? It's a combination, and researchers. I think that was an important point, Frederick, you mentioned, is the importance of researchers being a part of this, and not just, as oftentimes we do, write journal articles that sit on the shelf, but making them really important and contribute to the discussion. But I'm curious, with that said, Nandy, you've mentioned a number of places that the Ghanaian government has been very supportive in terms of legislation and providing the legitimacy to some of these cooperative efforts. And so I'm curious, what more can the Ghanaian government or governments like the Ghanaian government really do policy-wise? In other words, what would you like to see them do ideally over the next few weeks, months, and next couple of years?
I think that they've done a lot, but then there's still room for improvement, because in situations where there are crises or emergencies, I think there should be a policy that requires that we have mental health experts also providing experts advice in that area. We also have situations where we need more sensitization and advocacy within the community, because we still have a long way to go in relation to that. We also need opportunities where we have more people educated and trained in the area of mental health to provide services for the wider population that would need such services. So these are some of the policies that I'm looking at government also putting together immediately to also provide such assistance to improve the mental health care system we have here in Ghana. Government also working with private sectors, NGOs, to also provide such support where they lack. So I think it's, and also research is very important, because most often we do a lot of research in our universities and it still is in the shelf, it's not being implemented. So I think if government looks at all these things, it would also go a long way to also improve the mental health care system we have here in Ghana.
Wonderful. So we are up against time, but I wanted to give each of you an opportunity, as I like to do, to kind of share your final thoughts. Obviously, we've covered a lot of different ground today in this conversation, and it's just the beginning of a conversation, arguably. But Frederick, first to you, any sort of last thoughts or things that you would like our audience to kind of take away in either your discussion of advocacy or the stressors, or even for themselves and thinking about the concern of mental health in this COVID-19 area?
Peter, thank you for hosting this very important conversation. I think for me, I would want to take my last take to be at the higher and at the policy level. We know that there's no health without mental health, and what you cannot measure, you cannot improve. My call really is for governments and government of Kenya to fund research. We depend, researchers and generators of evidence mostly depend on funding from abroad, from other well-wishers, people who perhaps in a way sympathize with the situation that we go through. Yet we have governments that are the best, the users of this evidence, and who really need this evidence to improve the welfare of the people. So my quick call really is for government to find money, put money aside, fund research, generate evidence that can really feed into their programming, into their policy crafting, and into the different activities that they issue for the welfare of its people. And really about the population, the younger people are perhaps the most affected. You're looking at mental health disorders starting well into when people are young and pulling through into adulthood. And things like emotional disturbances and anxieties are really prevalent in the society more than we can think they are. So it's important that at the primary level care, we have people can really easily offer help to people as and when they need it in a walk-in, quick desk, quick position to get help. And I think we're going to improve the life and the welfare of our people if we embrace it.
Wonderful. And last to you, Nandy, the last word for today.
Okay, so I would also encourage my government that I think that there's so much work to do in the mental health sector. And I think that the budget that is provided for mental health care service annually should be increased, because there's so much work to do in the area of infrastructure, because we have a lot of challenges with even where a patient will sleep. We have a lot of challenges with staffing or experts in the area. So government should look into that and revise and improve the budget as well as resources provided. I would also want to say that in social distancing and physical distancing does not mean that we should emotionally detach from others. Emotional and social support is still very important. Spirituality, the spiritual positive aspect of our spiritual practices also serves as another form of intervention to help people in this COVID pandemic times. And so in times of challenges, in times of anxiety, stress, if you need to reach out to someone, just call on the mental health experts or your church, and they would send you to the right place to help you in these challenging times. Thank you.
Well, thank you, Nandy, and also thank you, Frederick, for your time and engaging in this really important conversation. And as I said before, I think it's just the beginning of a very multifaceted conversation, both from a public health perspective, from an advocacy perspective, as well as a perspective of policy as well, and public policy, important public policy. So thank you to you, Frederick, and thank you to you, Nandy. We really appreciate it.
Thank you very much.
Thank you for having me, Peter.
And thank you all for joining us today on Leaders of Africa Live. It was really good to be with you. True Leaders of Africa care deeply about mental health support and making it both accessible as well as equitable. Let us continue this conversation and stay tuned for our next conversation coming to you soon. To hear first, subscribe to our YouTube channel, like our Facebook and LinkedIn page, and join our Telegram app group. You can receive all the information there about our next Leaders of Africa Live session. Remember, if you are facing mental health stressors, please seek help as our guest suggested, and stay safe and take care of yourself and others. Until next time, my name is Peter Pinar. It's been great being with you. Take care.